Good evening, and thank you very much, Martin, for the introduction, and thanks to Curia for the invitation. I am delighted to be here. I'll be old school, I'll use the podium and the microphone, but I want to say how delighted I am to be here. And I'll let you into a secret how delighted I am to be in government. On the journey from my last engagement to come here, I had to walk past the shadow cabinet room, and it was getting a little bit noisy, and I thought, there's a Christmas party on there. I wonder what I'm missing. And then when I walked past, I realised that we're not the shadow cabinet now, and that's not my lot in there having fun. And that's a good problem to have. But look, this new Labour government has inherited a National Health Service that is far from where we want it to be and far from where we need it to be. As Lord Darcy's report set out, our NHS is broken, but we don't believe it's beaten. We still believe the best years of our National Health Service lie ahead of it. But it needs a concerted effort by the whole country as part of a 10-year mission for national renewal to get our health and care system where we need it to be. And that's not just about fixing our broken NHS to meet the needs of today. It's about using this unique opportunity to shape a health and care system that meets the needs of the future. And that's where it gets terribly exciting. Now, as you'll be aware, we're in the midst of the biggest ever national conversation about the future of our NHS. Reports like the one being launched this evening that collect insights from industry experts are more important than ever before, and we need to make sure that all the findings of this report are fed into that process that will develop our 10-year NHS plan. Now, we've also asked the public for their ideas on how to create an NHS fit for future. Some of the suggestions have maybe been less serious than others. Look, I like West Streeting, and I'm not sure I would fire my boss out of a cannon. Although my officials did have to convince me that a Wetherspoons in every hospital wasn't a serious idea. But look, in all seriousness, we are still listening to every voice to create a healthcare system that works for everyone, no matter where you live or who you are. And why this really matters, look, set aside the day-to-day problems that we have currently with our NHS. There are more fundamental problems here. On my first day as a minister, I was sat down in my new office in the Department of Health and Social Care, and I was shown a series of slides. And I want to dwell on two of those slides to set the scene. The first was a very simple bar chart. It had two bars, and this signified the life expectancy of two women living in two very different parts of our country. One woman privileged to live in a less deprived part of England, and the other one living in a more deprived part of England. And what I was briefed on was truly shocking. The woman in the less deprived part of the country will live on average to around 87 and a bit years. Her counterpart that lives in a poorer part of the country will live to 78. Not quite, but as close to a decade's difference as you're likely to get on average. But that wasn't the most shocking part of that graph, because the two bars were partly coloured in a different shade. And the orange bit signified healthy life expectancy. And for the woman who lives in the less deprived part of the country, living to 87 and a bit years old on average, she will fall ill with comorbidities in retirement at the age of 71. So she will have lived all her working life in good health and only starts to fall ill at 71, and is around 15, 16 years of her remaining life in ill health. But for that other woman who will only live to 78, she falls ill with comorbidities at 52. And to me, that shocked me to the core. That is morally reprehensible, and it is economically for the madhouse, because that woman will almost certainly be living in pain, in misery, in poverty, and out of work for large periods of her adult working life. That's wrong on so many levels, and we have a duty, and it's incumbent on this government, and it's integral in our health mission to narrow those health inequalities and to narrow the gap between the healthy life expectancy of the poorest and the richest regions of England. And that is going to be a big challenge. And it means that as part of our 10-year plan, we have to undertake 3 big shifts. And this is where we remodel the way we do health and care in this country going forwards. Because our NHS in its current form has served us well for the last 7 or so decades. But going forwards, the challenges of health and well-being means that we need to shift the way we do our health and care in this country. So the 3 shifts that we are consulting on as part of our consultation for our 10-year plan are firstly from hospital to community, because there is so much more that can be done within a community setting, or even, dare I say it, in the home setting, that needn't be done in hospitals. Now, of course, there will always be need for specialisms, there will always be a need for emergency care, and there will always be a need for hospitals. But still, in our healthcare system, far too much that is currently being done in hospital could be done in other more convenient settings. The second shift, and this is really pertinent to much in this report, is the shift from analogue to digital. And that isn't just about the NHS app and what we can use on our phones, the smart use of data, the revolution of AI, which is moving at such a pace. On one level, it's frightening. It is literally science fiction becoming science fact. But if we get it right with the right frameworks, the right protections, the innovation can be a massive game changer, both in terms of productivity and outcomes for patients, that is just mind-blowing. And at its most simple level, I had the privilege on Sunday of visiting Great Ormond Street Hospital, and I had a mock consultation where we talked about football and politics and my family, and my health as well. And the AI automatically dumped all the irrelevant rubbish stuff about football and politics and my family, picked out all the stuff about my health that I chatted with the consultant, wrote the consultant's notes, and they were perfect, and sent me a letter probably before I would have left the hospital, outlining not only what the consultation was about and what was found and what the doctor's opinion was, but also the date for my next appointment with whoever it was. And that just blew my mind. And that is just a small example of where modern technology can both drive up productivity and improve patient experience and patient outcomes. But it's also about supporting the life sciences industry and making sure that in the United Kingdom we have the right framework in place, the right regulation in place, the right attitude at the heart of government to encourage that innovation, to encourage the advancing of science and technology, medtech, life sciences, pharma, and getting access to those medical trials for British patients and getting early access to some of the latest innovations and treatments and getting better outcomes as a consequence. And then the third shift, which is interrelated to all of it and is most important to me as the Public Health and Prevention Minister, is that shift from sickness to prevention. And that's where it leads me on to the second slide. Our NHS today is spending around 40% of its budget on fixing entirely preventable illness. And with the demographic challenges of the decades ahead and the cost pressures of providing healthcare to meet those demographic challenges, because we are living longer, but like that first bar graph, we're living longer with comorbidities and at greater cost to the healthcare system, that percentage grows exponentially. And that is not sustainable. And what it means is in 2 decades' time, I will hopefully be retired, but at some stage, a successor of mine will be standing here and will either, depending on their views and opinions on healthcare, be advocating for the fact that the NHS is completely broken, is completely unsustainable. We no longer have a free healthcare system at the point we need it that is universal for all, and we make the argument for a different way of doing health, probably an insurance-based system. That sends shudders down my spine. The reality is, if it's somebody like me in 20 years' time standing here and we haven't fixed the system, I will be saying that ever more of your taxes will go into healthcare and there will be less of national income for education, for defence and everything else that you expect government to do. Neither of those things is sustainable, and that's why these 3 shifts are important. Now, on life sciences and the NHS, the theme for this evening, diagnostics and life sciences, is a key part of the NHS puzzle. Innovation in life sciences can deliver more treatments, more diagnostics and other life-changing technologies that will help people live longer, healthier lives. And on top of this, the sector has great potential to drive growth, which is the number one aim of this government, and create high-skill, high-wage economy. Now, to deliver this, we are setting out a life sciences plan as a key part of our industrial strategy that will address the barriers to growth and renew the UK's leadership in life sciences. Now, on diagnostics, as I say, the 3 shifts that we need to make if we are to create an NHS fit for the future, from treatment to prevention, hospital to community, and analogue to digital, are going to be key, and diagnostics will play a critical and central role in all of these shifts. Earlier diagnosis means deadly diseases are caught in days, not years, and significantly improving patient outcomes and saving NHS resources down the line. And to give you an example of this, earlier today, I was in a meeting talking about the targeted lung health checks. And this has basically targeted some of the poorest communities in England, where smoking prevalence is still higher than the national average, where there's industrial legacy, and where lung disease is still incredibly prevalent. And by having that early diagnosis through that screening programme, we have transformed in those poorest communities the outcomes of so many people, because we are identifying in stage 1 and stage 2 in those communities around 75% in total of those people that go on to develop lung cancer. And that is a remarkable turnaround since just 2019, when it was almost the opposite way round. We were diagnosing around 30% and the rest were going undiagnosed until the later stages and leading to their untimely deaths. On genomics, this is an area where the UK has been a world leader for decades when it comes to genomic research. And every year, the NHS Genomic Medicine Service carries out around 750,000 genomic tests, including for cancers and for rare genetic diseases. But despite that success, people living with rare diseases often face long diagnostic odysseys, journeys that take over 5 years on average before they get their final diagnosis. And this can take an enormous amount of mental and physical toll on those people and their families. And look, it's something that this government is determined to address. This morning in Westminster Hall, we had a debate on rare diseases, and I gave a commitment that we will be looking incredibly closely at how we better use through the funding of NIHR the research when it comes to rare diseases and genomics. And then on maternal care, genomics is ushering in a new era when it comes to maternal care through newborn screening. The Generation Study is a world-leading study that aims to screen up to 100,000 babies for rare genetic conditions, where early detection of these conditions can improve outcomes through treatment on the NHS. And the study has already screened hundreds of babies and will help inform policy decisions on whether whole genome sequencing should be offered to all babies at birth. Through this service and others, we are delivering on our commitment to provide an evidence-based improvement to maternity services, ensuring that all women and babies receive safe, compassionate and personalised care. We've also heard how, as I say, the NHS is broken but not beaten. And if we're serious about fixing it, we have to bring everyone together to pull in the same direction. And that's why this government needs your expertise, needs your voices, and needs your networks to help us shape the next decade of our NHS and what healthcare beyond that next decade will look like. If you've not already gone on to change.nhs.uk, please do so, and we'll only accept serious suggestions from people in this audience. But it is really important that you play your part, that you feed in your ideas, and that we shape the future of our NHS together. So please spread the word, talk to your colleagues, and have your say in shaping the future of our NHS. But I truly believe this: we are on the cusp of the next industrial revolution. And it is life sciences, it's AI, it's the smart use of data, it's genomics, it's all this really fantastic work that is going on right now, that is going to be at the cutting edge of how we deliver health and care in the future, and how we tackle that bar graph on stark inequalities in this country is in part down to the innovation and the brains and the expertise and the nurturing of talent that having a credible life sciences strategy in this country will bring. The NHS was the leading healthcare system for the 20th century. I want to make sure that as we rebuild it for the 21st century, we aren't just the leading healthcare system, we are the system that has grabbed this opportunity at the right place, at the right time, to shape health improvement in this country based on science, technology and innovation. And together we can achieve that aim. Thank you very much.